Hi, Principles of Biomedical Science students. Here is a video walkthrough of 1.2.5. So I'm using, as always, Block 1A's class as the Google Classroom I go to. Click from Stream over to Classwork. Now you'll notice I put some extra credit in there. You can do that whenever you'd like. And I'm going to scroll to, let's see, Monday, 11/16. If you're watching this and you're on my 1B class, it would be in the Thursday 11/19 folder, okay? So go ahead and click this open. We're going to start learning about the heart. Pretty fun. And also, while I'm doing this, take a minute to log on to my PLTW, okay? So I'm making a copy so that I can type in it. You don't do that, but I do. All right. So you've logged on. You've got this open. You're going to log on to my PLTW. You're going to click on Courses, as always. And from your course library, oh, that's changed. You're going to pick Principles of Biomedical Science, as always. And on the left side scroll bar, click on Lesson 1.2, Master the Morgue, and scroll down to 1.2.5. But Miss Ayat, you might be thinking, we didn't do 1.2.4. We didn't, and there's a reason for that. So just bear with me as we do things out of order. Okay, so we're doing gross anatomy examination. Fun, right? Totally. All right, while we do that, you can pause it or fast forward through this part because I've got to log on to the teacher page too. Because there's a video that's super exciting. Not at all. I'm going to have you guys watch as well. So I'm doing that. Let's go here and look at our goals. Let me make this bigger because I've noticed that it's kind of hard to read. So our goals: explain heart anatomy and function, analyze models, and perform a dissection. We will do that when we come back face to face, but we get to watch a video of somebody performing a dissection. Sad face. And use medical information in a gross examination to diagnose heart disease or disorders. Fun, right? Oh, it is and it isn't. So here we go. Here is a beautiful picture of the heart, cartoonized. This assignment right below it, create a heart box according to the instructions. That's for tomorrow. I realized how big this assignment was getting, and I sort of clipped it down and spread it over 2 days. So now it says, watch the heart dissection video. So we're going to go over here, gross anatomy examination. You don't need any of that stuff. Sad face. And let's see, medical examiners look at tissues. Here is a beautiful model of the cardiovascular system. Oh, you know what? If you take all the veins and arteries out of a person and lay them end to end to end, that person would die. You thought I was going to give you some ridiculous length, didn't you? But now you're paying attention again, so that's good. All right, so here we have viewing the heart, anterior, posterior. When you are dissecting the heart in person, when you make your heart box, you always have to imagine you're looking down at somebody's chest. And the hardest thing to get used to is that left is actually the right side of the heart when you're looking down at it, because it's like you're looking at a person's chest. So left is right and right is left. So you see here, it's just like I just said. Here's the right ventricle on the left side of your screen. It's because you're like looking at a person laying in front of you. You're looking down at their chest. That's how come that is. So here we go. Pulmonary and systemic circulation. Pulmonary, pulmon means lungs. Take medical terminology, kids. And systemic means the system, the body systems. So pulmonary is when the blood goes from the heart to the lungs and then back to the heart. Systemic is when it comes back from the lungs into the heart, then the heart pumps it through the body. So let's see, we're scrolling. Here are the directions for the heart box, which you'll do tomorrow. Spoiler alert, I know. And here is the heart dissection video. I hope you can hear this super cool music. Here we go. All right, so there it was. Not as fun to watch as to do, but we will do that when we go back face to face. Fingers crossed. Really hoping. All right, so let's go back to our lab journal. We watched the video. We haven't done the heart box. We'll do that tomorrow. Like I said, let's scroll down. So here we go, problematic hearts. So we have description and symptoms of all of these things. So we'll start with angina. We go here. Woo. There's the heart again. Scrolling down, click through the interactive. Are you going to not work for me? There it is. Okay, so angina. Here we go. So I'm going to expand the description. There's 6 of them here. Angina is chest pain or discomfort due to reduced blood flow to the heart. Patients with angina often describe feeling squeezing, pressure, tightness, or heaviness in their chest. So those are symptoms. Highlight those. Control C for copy. Control V for paste. Oh, I put it in the wrong spot. There we go. That's okay. That's what delete is for. Here we go. Symptoms, right there. Oh, not Shift V, Control V. So squeezing, pressure, tightness, or heaviness. And it did say right here, the description is chest pain or discomfort due to decreased blood flow to the heart. So I'm going to highlight that first sentence. Control C, Control V. There you go. If you've ever wondered what angina is, now you know. Atherosclerosis, fun to say, even more fun to learn about. So we can look at this. It's a symptom of coronary artery disease, is still angina. The buildup of plaque, let's see, atherosclerosis in coronary arteries can block blood flow. Uh-oh. Here we go. So, atherosclerosis. So it's, let's see, it has description and symptoms. So here's the description. The gradual buildup of plaque in artery walls. So I'm going to control C that. I'm going to control V it right here. So atherosclerosis is the gradual buildup of plaque in artery walls. And ironically, one of the symptoms is angina or chest pain. Let's see if it lists any others. Let's see. Damage can cause stiffness. Total occlusion. Let's see. Plaque can grow in size until it blocks an artery. Heart attack or stroke. I suppose we could put those as symptoms, although those seem like bigger problems. The symptoms of atherosclerosis are diagnosed through a secondary thing, which sucks. But speaking of heart attack, myocardial infarction. Now, that one's a fun one to say. So we've read through this. Myocardial infarction, not infunction, infarction. A serious condition that occurs when blood and oxygen is reduced, causing part of the heart muscle to suddenly die. No. That is a description. I'm going to highlight that and Control C and Control V. It's a fancy medical way of saying heart attack, which is not good. All right, so let's see. Commonly results from plaque blockage, atherosclerosis. So symptoms, I know that they're here. You can read all about how they happen. It's kind of sad. And here we go. Chest pain, arm pain, increased heart rate, sweating, fatigue, and nausea. Highlight that, Control C, Control V. These are very generalized symptoms of a heart attack. And the symptoms vary actually in men and women. So it's kind of an interesting thing. If you wanted to look that up, you could. Aortic valve stenosis, our second thing, our fourth thing. I can count. Here we go. Aortic stenosis is a heart condition that occurs when the aortic valve narrows, partially obstructing blood flow across the valve. I'm going to highlight that. I'm going to Control C. I'm going to Control V. That's the description. The aortic valve narrows, partially obstructing blood flow across the valve. So that's where blood goes from your left ventricle into your aorta and then into the rest of your body. So let's see if it has symptoms. Here's what it's caused by: calcification of the aortic valve. May not experience any symptoms. Let's see. In patients with advanced AS, here we go. Chest pain, dizziness, and fainting during exercise, and congestive heart failure. Yikes. I'm going to highlight those symptoms. I'm going to paste them. Okay? Those are some pretty unfortunate symptoms. So now let's look at patent foramen ovale, number 5 on our list of top 6. It's an abnormal hole present in the wall between the two upper chambers of the heart. It's congenital and, well, that means it's present at birth. Okay? I'm going to highlight that. That is the description. And if you look at it, it says the hole is usually very small and it's typically asymptomatic and harmless. So, asymptomatic and harmless that many people who have it don't even know they have it. But there are some other complications here, including ischemic stroke, migraine, headaches, and heart attack. Now, if you get migraines, please don't go thinking you have this. Don't self diagnose. There we go. Those are some severe symptoms, so I'm going to put them there. Next, we have congestive heart failure. Here we go. Congestive heart failure is a cardiovascular disorder that occurs when your heart cannot pump enough blood to supply the body. There's our description. Control C, Control V. The description, let's see what the symptoms are. Let's see. Oh, look at this. CHF can be caused by a variety of disorders, arrhythmias, cardiomyopathy, and heart attack. Let's see. The walls of the ventricle are thin and weak. Well, that sucks. They are unable to adequately pump blood. Ooh. And so it sits in the ventricles, reducing the amount that can get to the rest of the body. Here is something that increases the risk. I'm going to put that. Oh, wait, here we go. Symptoms. I almost gave up on symptoms. Fatigue and weakness, shortness of breath, swelling of the lower limbs, decreased alertness, and a reduced ability to exercise. Control C, Control V. Now, you may notice that's 6 of 6, but we still have part of a chart to do. You have sudden cardiac arrest, congenital heart failure, valve defects, atrial and ventricular septal defects, Eisenmenger syndrome, bacterial endocarditis, and hypertrophic cardiomyopathy. You will complete this chart using the Google. Okay? That's why I broke this assignment into 2 days, because you have to do this on your own. What? Why? You'll be all right. Okay, so now let's look at Anna's heart. Here it is. It's beautiful. Look at those chordae tendineae. There they are. The papillary muscles, septum, left ventricle, right ventricle, left atrium, right atrium. We have the, let's see, the aorta. Does it show any defects? No. No defects present. So you'll update the autopsy report to reflect that Anna had a normal looking heart. So here we go. In most of the body, arteries carry the oxygenated blood and veins carry the deoxygenated blood. I can talk. And veins carry deoxygenated blood. Too many vowels there. The exception to this pattern is in the heart. Explain how and why specific arteries and veins of the heart are different from the pattern seen in the rest of the body. Think about it. You may not know this one. Maybe pause me and Google it. Here it is. The pulmonary artery carries deoxygenated blood from the heart to the lungs. Pulmonary vein carries the oxygenated blood from the lungs back to the heart. Now that's a thing you know. Using what you have learned about the structure and function of the heart, explain why left ventricular hypertrophy can be fatal if left untreated. Okay, so if you filled this in, I think that's one of the things you had to look up. Maybe not. Oh, yeah, hypertrophic cardiomyopathy. So we're talking specifically hyper or above normal trophic growth in the left ventricle. Well, the function of the left ventricle, it helps to know that. Left ventricle carries blood, not carries, pumps blood to the entire body. If the muscle is not functioning, that's a good word, correctly, then the left ventricle cannot pump blood effectively. This can cause the heart to work harder than it should. And just like a car part, if it's working harder, it may wear out. That's why it's fatal. Your heart wears out, you get no oxygen. So let's see. An otherwise healthy young adult could have a serious heart condition. Well, the same reason some people get type 1 diabetes, it could be an inherited condition. I keep bringing up the Anna Garcia from the previous part of this curriculum, the previous years. She had inherited high cholesterol, which was hard on her heart. So, inherited condition like high cholesterol. There are other reasons an otherwise healthy young individual could have a serious heart condition, including but not limited to drug abuse, uh, poor life choices, and we'll leave that inherited thing there too. Although drug abuse, I think, would be a poor life choice. Just say no, kids. All right, some lifestyle choices. Hey, I was just talking about that. You could make, and some risk factors to avoid to maintain a healthy cardiovascular system. Well, thing number one is probably the first thing a doctor will say to you if you ask is exercise. That is a good lifestyle choice. Exercise. Risk factors you should avoid. Yep, avoid bad foods. Avoid smoking. Avoid drugs. Just say no, kids. Okay? And you can think of some other things there too. I'm sure you can. You guys are smart and on it. So I'm going to leave it at that. Okay, so for 1.2.5, before you turn it in, use the internet and finish this chart, okay? All right.